Thanks very much indeed, John. And setting the scene is just exactly what I hope to do, and I hope to do it in accordance with the advice which the old diplomat gave to the young diplomat. He said, success in your career, particularly at conferences, depends on doing three things. Speak clearly to be understood, loudly to be heard, and briefly to be applauded. So the underlying theme to today's conference is, in fact, about work. And work is the transcending challenge for our society at the moment, particularly the creation of opportunities for work for people who are unemployed and people who are searching for work. But in a sense, you could see that part of our agenda, Fit for Work Coalition, is also about ensuring that people who have the capacity to work and the willingness to work and the ability to work can remain at work. And because, I suppose, in summary at the moment, we have a situation where people who are suffering from MSDs are discouraged, not actively, but through the system and the barriers that they encounter, they are discouraged from working. And the agenda of the Fit for Work Coalition gels very neatly with some of the other agendas I'm concerned with, particularly the agendas of the National Competitiveness Council, which is basically the enhancement of productivity and effectiveness in our society. So we all in different ways have experiences of what MSDs mean for the individual, for the impact on people's quality of life, for their opportunities for economic and social participation, particularly through work. And you'll be hearing a lot today about the costs that are imposed on society and on individuals from MSDs. But a few of these figures, I think, are just worth repeating a number of times, so I'll just start with some of them. First of all, up to 80% of the Irish population will at some stage or other in their lives experience an MSD. So this isn't a rare phenomenon. It's something which is an integral part of many of our lives. MSDs are a leading cause of ill health in the workforce. And the cost figures, again, are very challenging. About 750 million estimate across the total range of costs arising from MSDs. But one figure stands out for me in all of this, and that's a figure of 275 million for the cost of illness benefit alone that are paid to people who are absent from the workforce, who cannot go to work because of MSDs. And at the personal level, too many sufferers from MSDs feel that they have no option but to leave the labour force or to leave the workforce. Now, what are the consequences of that? The consequences are losses in income, discouragement, perhaps depression in some cases, and reduced social as well as economic participation. None of these are positive outcomes. But those are the costs for the individual. But then you look at the enterprise, you look at the firm, you look at the public service agency or public sector body. What are the costs for them? There are reductions in inefficiencies, because very often the MSD sufferer will be somebody with considerable work experience, develop considerable skills, will be a very valuable member of the workforce. So you have a loss of competitiveness both at firm level and indeed at national level. And then the third entity bearing the costs is the exchequer. They're the costs of illness benefits, the costs of absences from the workforce. And as I've said earlier, these costs are not trivial. And because I had some association which has really made my family feel very ashamed of me with the local property tax, the potential benefits of a more rational strategy and a more humane strategy and socially just strategy towards MSDs are comparable with the revenues, half-year revenues that will come in from the local property tax this year. So we're not dealing with trivial issues here as far as both the exchequer is concerned, as far as our society is concerned, and as far as individuals are concerned. The important thing is that there are strategies, and some of you will know a great deal about them, and some of you will be talking about them today, that improve people's MSD sufferers' capacity to continue to work in the labour force and indeed to enhance their lives. These will also, of course, create exchequer savings and improve economic performance. And as we all know, work is a therapeutic outcome for so many of us. So many of us get our identities from the work we do. It's a fact of life. So you'll be hearing about these positive interventions today. There's one that has particularly impressed me because of my previous involvement in the Department of Education and Skills. A very thorough occupational health strategy was launched by the department with the assistance of health professionals to improve the to reduce absenteeism among teachers at primary and second level. And the results of the strategy were to reduce workplace absences by 17%. And this resulted in savings in the substitution costs for the department of the order of somewhere between 12 and 14 million per annum. But also, of course, this improved education outcomes for the pupils, for the children in the schools. So again, that particular exercise is, and remember, this is taking place in most of the schools in this country are small schools, so they're comparable to small and medium enterprises in terms of their limited management capacity and their capacity to do things for themselves. They're not large organizations. So that study is very illustrative of the benefits, or not that study, that experience is very illustrative of the benefits that can be accrued. So my belief, and the thought, I suppose the underlying thought I'd leave you with, is the Fit for Work agenda is a practical one. It makes economic, fiscal sense. It improves social justice. So it hits three important buttons. And in these stressful and challenging times, those are very valuable synergies. Thank you very much.